Morena, everybody. I'll just share my screen. How's that look?
Spot on.
Excellent. Okay, well, I'm aware there's a broad range of people in the audience, so I'm hoping that there's either something for you here, something that sparks a thought, and I would just encourage you, if there's something that you want to know more about, you'd like the slides, a reference, or to ask questions later, please get in touch, and I have included my email at the end. All right, so a little bit about me. So, ko tirana, ko ingarani o ku tipuna, no te tihi o maru aho. So I was born in Timaru. Ke te noho o Tamaki Makaurau, ko Annabel Grant, tōku ingoa. So yeah, I've got family links to Te Waiponamu. Had family there and did my training down there. And Susan mentioned I am doing my PhD in this field of dementia and social connections. So I have a strong feeling that we can do things to support people to keep social connections going, because as I'm learning more and more, it's really good for our brain health and our wellness overall, when we can stay socially connected. And I think that would be one of my messages, that although I'll start with a little bit broader, that really I'll be giving some practical strategies about how to keep conversations going, because that's how we socialize, through conversation. And I think having a good conversation is an act of caring. So hopefully there's something in here that might help you to support conversation going forward. So I think one of the overarching concepts that I quite like is building reserve. And obviously my favorite topic is in there, social reserve. So I guess just to put it in a context, when we think about brain reserve, that might be how much structure in the brain you have, your neurons and connections that you have to back up all the thinking and conversing and socializing that we want to be able to do. The cognitive reserve is, I guess, how does your brain use those structures, those connections and different parts of the brain to work around, perhaps if with dementia happening in the brain, maybe the cognitive reserve means you've got something as a backup to work around and find a new way of hopefully keeping communication going. I think emotional reserve is important, and you probably hear things about filling your bucket. And I guess in the act of either living with dementia or talking with somebody with dementia, at times you have to have some emotional reserve, perhaps more than you needed in the past. So I guess if you have some emotional reserve, you can handle the ups and downs of day-to-day life and day-to-day conversations. I guess we're aiming that somebody living with dementia can keep some confidence, their sense of identity. Perhaps you're the conversation partner, can you control your feelings and just think reasonably about the situation in amongst times where perhaps there's memory loss or someone is experiencing confusion. So I think for people living with dementia, that emotional reserve helps them to, still keep their sense of humor, their core identity, despite some of the changes that might be going on in the brain. So I think emotional reserve is really shaped by how much social reserve the person can access. And I hope that by the end of the talk, you might have a few more ideas about how that can be built up through good communication skills. That's the aim. So I think you all have some ideas about what good communication is in your day-to-day lives. We know the basics, so they all still apply. So the things like eye contact, not talking too quickly, not interrupting somebody, being a good listener, picking up on somebody's non-verbal, their body language. So we know it's not just words. So, don't throw those things away. But I guess we're thinking about the wider context. And again, that idea, how do we build up someone's social reserve? How can we ensure that they're able to communicate and converse? I think that some of the broader attitudes to dementia in society can influence. So I guess I'd be hoping that messages become more balanced away from, I guess, negative depictions of what it might be looking like, acknowledging that there's ups and downs, but also showing that there are ways that we can help people maintain social connections and have good conversations, despite, new challenges. It's important because, keeping, I guess, socially interactive, as we know, is good for the brain. So I guess we're thinking, how can somebody keep some autonomy about how they connect socially, making choices about who and where and how they want to interact. And again, that idea that having a good conversation really is an act of caring. So I guess getting down to a bit of thinking about how do we communicate effectively and what are some of the core skills. And obviously it's a interaction between a speaker and a listener, and whether you are the listener to somebody with dementia or vice versa, you're both engaging in some observation and mind reading to get the job done. It's not just about the words, it's you thinking what's going on in this communication situation. So obviously we're thinking, how can I put my message together in a way that's going to work well for this listener? We might observe, seeing, do they look like they're on board with what we're saying? Do they, are they looking like we might need to rephrase something? So we kind of also mind read. We're thinking about, what do they know or understand about the topic that I'm talking about, and vice versa. How's my message going to come across? So we need to sort of, think a little deeper, I guess, especially in the situation of keeping up conversations when one of the people has dementia. And I guess we'll go through some strategies, but just practicing thinking about what the other person might be wanting to achieve, what understanding are they coming from when they enter into the conversation, what might be hiding under the surface of the words that are coming out. How can you reassure somebody that you are listening in a deep way? So I think quite a useful way to think about approaching a conversation is scaffolding. So what do I mean by scaffolding? I would say that you might be thinking about changing how you say things to make them easier for somebody to respond to. And often the idea of just asking somebody a yes/no question, or what we call a forced choice, just saying, do you want A or B? Those are the things that tend to come up. But I think we can do better because, conversation is much richer than just batting questions back and forth. So rather than asking somebody a fact question, which we know when there's challenges to memory, that can be too much, we want you to provide more context. So I'll give you an example. If you asked somebody a question that's asking them to pull a fact out, you might say, perhaps in talking about their husband, when did you meet him? So you've asked a fact question that is hard, and you've said him. So that's, not giving much of a clue. So I would say there's no scaffold. If you provide a little bit of context, you might say, how did you feel when you first met Dad? So there's a bit of a scaffold. You've been more specific and used the word Dad. But rather, if you were going to fully scaffold and provide as much support as you could in that chat, you might say, I know you met Dad at a dance when you were both living in Raglan. How did that feel when you first met him? And that's a much more significant scaffold. you haven't started with a testing question. You've shared what you know, and then the person can recognize the specific words. You've given them lots of cues and pointers, and they can come in and join in the conversation because you've given that scaffold. So the starter, didn't you, can be quite a useful one. Didn't you used to be a nurse, so didn't you tell me once that this happened? So that's the start of thinking about how you might scaffold the conversation. The other idea there is using visuals, and I'll come back to that idea. Lots of examples. So just some changes to improve conversation, getting down to some of the specifics. It might be about the timing. I mentioned rate early on, rate of speech. Some of the advice says speak slowly. I would say be careful not to speak too quick, but just keep it natural, because I don't think speaking really slowly, I think it can come across as patronizing, and yeah, I think just not racing along could be useful. But it's the leaving the pause, which actually in normal conversation is like a split second. It's just so tiny that we bat conversation back and forth. But if you just leave a little bit of a gap, give someone time to process and respond. And when somebody's trying to communicate, even if they have quite a long pause, doesn't necessarily mean they've finished their turn. So I guess it's just being a little bit more tuned into what is the ideal pause. You don't want to leave it too long, then everybody might forget what the topic is. But certainly just be aware of how long the pause you leave is. I talked before about the fact questions. So rather than asking them to dredge up a fact from memory, I think you said you were a typist, or didn't you used to, be a horse rider. So any way to avoid asking test questions, rather adding in those scaffolds, works really well. Tag questions as well. So that's where you say, oh, your daughter came to see you this morning, didn't she? Rather than saying, who came to see you this morning? Those sorts of tips and tricks work well. If you are the person living with dementia, how might you approach things when you can't find that word? We know that vocabulary starts to shrink over time. So what might you do? If you can't think of the word, you might be somebody who can laugh it off and move on and say, it'll come to me later. Or maybe you enlist the help of the other communicators in the room and you say, oh, sometimes I can't find a name. Can you suggest, help me out or give me more time? So taking charge of the communication situation. If it's something you really want to get it right, maybe you write a script out, or jump online and ask one of the AI tools to give them a few words and say, please write me a script to explain a concept or prepare for a piece of communication. So I think there's a role for bringing in technology to help you plan what you want to say and perhaps rehearse things. And I guess just appreciating that people want to help you understand. You can draw a line in the sand and say, this is what's going to help me, so that they get it right. You don't want people to over accommodate and talk down into being patronizing. Just saying what are the things that will help you stay in that conversation. Yeah, and then if you're the conversation partner, again, do they want you to help by suggesting a word? Do they, do you want to say, did you mean such and such? Visuals, we'll come back to that one, using pictures or rephrasing your message if, again, you can see that it didn't land correctly. Maybe thinking about using words that are maybe simpler and more commonly used might be good. So the example there, saying the stamp collector was 100 years old rather than the philatelist was a centenarian. Just be aware, and I know that day-to-day variability is common. So, you know, if somebody's very tired, that's going to hold things up. Could you come back to it later, or note something down and revisit it? If you're keen to know more and to perhaps see some video examples of these communication tips and tricks, there are programs available. This one's called Message. It's from the University of Queensland, and if you go onto YouTube and look for UQ Dementia Care, you'll be able to access videos showing you an example of each of these kind of communication scaffolds or supports, some of these that we've mentioned already, about using shorter or simple or familiar words, picking up on body language, and assisting with visual aids. We'll have that example. So just to pause here, one of my favorite, I guess, quotes that I heard about approaching conversation with people with dementia was to think of it like a dance. And this was from Heidi Hamilton, who's a professor of linguistics in the States. And she said, talking is like dancing. So dancers who are sensitive to what their partners can and cannot do make important choices that can make their partners look elegant and agile, or ones that can make their partners look silly and uncoordinated. So I think those scaffolds that have been mentioned are ways that you can make your conversation partner look competent. The words you choose, the way you structure your sentences, how you support, are all ways to support the situation. You may have come across the idea of carousel questions or repetitive conversations is something that comes up. So how might you deal with it when a question is being asked repeatedly? Think of it as a carousel. I guess the person's getting on the conversational carousel, you know, gets the conversation started, and it comes around again. And obviously memory, you know, the reason is because of that short-term memory problem. So just have a think, and just think, what might the person need? You know, is it less about what they're asking repetitively, and is it something that they need, that you know, do they need to connect? Is there something that is a want that is deeper than just the surface meaning of this question that they're coming to? And I guess this refers back to the emotional reserve, you know, how you building up your emotional reserve so that you can, with patience, provide reassurance, you know, keep your answer simple, acknowledge if there is a feeling behind the question that's coming up again and again, using a memory aid, maybe writing down what the questions tend to be and what answers worked best to allow someone to move on. And I guess sometimes we might all just need to distract ourselves by going for a walk, you know, having a snack, saying we'll come back to it later, or perhaps using a visual, which is the next example. So I've mentioned visuals a number of times, and it's one of the strategies in that message list, and is a really good way to scaffold conversations. You literally can be on the same page as the person that you're talking with, something that you can both see, helps to center the conversation, helps you talk about the here and now, and talking about the here and now usually works better. So it can be the newspaper, old photos, going over a map of you know, the trip you've planned for, you know, going away to a batch at Christmas, whatever it is. Having something that you're both looking at can help. Then you can give your opinion. You can say, oh, I didn't realize that you had to drive through Kaitaia to get there. And then the person's got that scaffold, they've got the same page, and then they can share their thoughts and ideas. Again, coming back to the idea of using AI, if you're running a group or needing some conversation topics, maybe you can go to a news website like the Herald Online, take an article, put it into an artificial intelligence. I use Claude, it's quite a nice one. People probably starting to hear things about Chat GPT. You can put the words in, say, can you please give me a easy to read, short paragraph that summarizes this this news, about the new presidential candidate in the US or something. An easy read version that could become your visual for the group or whatever activity you're trying to do. So okay, so a few kind of checklist things of things to think about if you're the speaker or the listener. So if you're the unimpaired person in the conversation, just thinking about some things. What did you do? Did you and ah a lot? Were you making eye contact? Yeah, what were you doing to scaffold the conversation to make it easier for the person to follow? So certainly one of the tips would be staying on one topic, as long as you can. And I guess, you might have a friend who jumps from idea to idea, topic to topic without any pause, and it can be quite disorienting and hard to keep up. So again, how can you maybe be a bit clearer about when one topic's finished and a new one starting, so that the listener isn't in that situation of trying to keep up. I guess just remember that how you say something might convey a lot. So your tone of voice, your body language, what your face is saying can carry more weight than the words at times. And the context mentioned before. So is there some, it's the person got some idea of where this topic's sitting. If you're going to change the topic, give them a warning or flag it. Almost, if you're writing a paragraph, sometimes you give it a heading so that the reader knows what the topic is. Can you do that somehow in a conversation in a natural way, just to accommodate? I guess consider expectations. Think back to those core ideas from earlier. To communicate effectively, you have to put your message together in the most appropriate way for your listener. So do that observation. Think about what the listener's able to do, and then mind read, work out how do you think your message is going to come across, so that it's sort of reasonable that they'll be able to take on board and respond. Okay. So yeah, just again, coming back to some things that you can help somebody do. Again, don't forget the basics. Has the hearing aid got a battery? Do they need glasses? And allowing them time. So we talked about pausing, maybe slowing down a touch, but not too much. And I guess the main thing is just being prepared to patch up a conversation, to fix it if it needs repairing, so that everybody leaves the conversation with their dignity intact. If you're the listener, I guess, again, just thinking, what did you assume they were going to say and mean, and was that the right assumption? I guess, yeah, I mentioned, thinking about what I want or a need, excuse me, underlying what they're saying. If they keep asking what the time is there some anxiety underlying that? Maybe they need to be reassured more than they need to know exactly what the time is. So just thinking about what assumptions you're bringing to what you're hearing and how you're evaluating that. Okay, so I guess one strategy to help keep things going might be to reflect back what they just said. Imagine somebody says something and it doesn't make sense to you. Is maybe try reflecting it back. So a lot of these tips and tricks have come from, again, a linguist called Alison Ray, who again has some lovely YouTube videos about conversation that I'm happy to share the link. She said, I think her mother had Alzheimer's. She said, Mum once said to me that she had 2 sons and no daughters. And I reflected back her statement like I had no idea about her sons, which in this case I didn't. She said, oh, so you only have 2 sons and no daughters. And then her mother went on to talk about her 2 brothers, which is what she really intended to say. So just sitting there with a bit of patience, reflecting it back meant that the conversation was repaired. Nobody lost face or was embarrassed. There was just some time given to, I guess, bouncing the words back and forth until the real thought behind that emerged. So yeah, just a bit of patience to fix things. So that being a good dance partner might mean just giving it a little bit more time. Memories. So memories was one of the things I said I'd covered. So I'd cover, and I think it links in with visuals that sometimes a simple strategy of gathering things together in a book or a folder to be able to converse and communicate about memories is a really good idea. So having photos, maps, written text about things that you like talking about, memories from the past can be a great idea. So that's something that you can tailor with an individual. It works well because once the information is down there, that the person, can pick it up as a tool for conversation and just recognize rather than having to pull a whole lot of facts out of the memory. So I worked with a lady called Evie when I was doing my master's. It's obviously a pseudonym, and she had a lady visiting called Janet. And when Evie was asked to tell the story of her life, Janet quizzed her and said, "What year were you training to be a doctor, or what year did you get married?" And Evie looked really, didn't look very confident in that conversation. She really struggled. She looked forgetful. She couldn't organize her answer. Then we put together a memory book for her with, photos of her wedding. We listened to her stories and wrote them down in paragraphs under each photo, holidays, pets, you name it. It was all there. And then revisited that conversation, and she just looked so much, she was in charge. She held the book, she told the stories, she embellished because she didn't have to pull out facts. She was just able to recognize and go from there. So that is, a memory book or having things down visually can just completely change the direction of a conversation. So it's tangible. There's no demands on your working memory. It's personally relevant about things that are part of your identity. So certainly, a great thing to do. People use their own vocabulary. It can be a book, it could be a wallet for gentlemen or for ladies that are used to carrying a wallet around in their pocket. Maybe it's less about life memories and more about names and words that they want to remember. So those are a really good tool. The size of the text is important. Obviously, you're dealing with, what visual skills people bring. Perhaps in the earlier stages, there might be some more complex information that could be simplified over time as needed. And maybe, again, using AI might be, useful. Just to jump to something else, if you rather than conversing about memories, if you just wanted to have a more imaginative conversation, then you could try something like asking beautiful questions. So there's a movement in the US called time slips that's all about, I guess, using your imagination to tell stories. And one of their, I guess, side projects was beautiful questions. So asking people, what kind of food makes you happy, or what's something you're proud of in your life, and jumping into a more imaginative conversation can be a lovely way to communicate. And you'll be able to find some information about beautiful questions on their website. I've got 30 seconds left, so I'm on the last slide. I'm doing well. The final I guess, way to approach communication that I quite like is the idea of quilting conversations. So just thinking about perhaps later on when people are giving you snippets of a story, but not the whole thing, that maybe you make a note and, do that thing where you reflect back. Oh, you were telling me about the dog on the farm, and then the next time you see them, you bring it up again, and maybe they embellish and they say, oh, he was a good boy. And then the next time you see them, you say, oh, you were telling me about the dog on the farm, and he was a really good boy. He'd wait for you. And just over time, you might start to quilt together all these snippets to get to a story that the person enjoys talking about and conversing about. And that, I think, is the end of my time. So I will stop talking. If you want references, want to know more about anything that I mentioned, that's my email address. So I'm going to stop sharing. And I think there's might be some time for questions.
There is, Annabel. You were so organized. I just loved that final kind of image of conversation as a quilt. I thought that was beautiful, Annabel. That working together and piecing together something that is useful and beautiful is just such a lovely way to think about conversations. And yeah, and I can see that Carolyn Barter was also saying that she loved the dance.
Yeah.
The analogy of a dance as well. So we do have some time for questions. You can either type them in, or if you raise your hands, we can turn to you.
I'm just checking the chat.
And just to say that Annabel has mentioned a whole lot of useful resources, and we will gather those together and send out some of those links that Annabel talked about, because there was a lot there, wasn't there?
Yeah, I'll do a slide deck that's, got the basics and got the links for you.
Yeah. And we've got compliments coming through and loving the practical ideas. So, Annabel, I was just wondering, I know that you've sort of been one of maybe the early adopters in New Zealand, I think, with the time slips. And I was just wondering if you could just talk us through a little bit about whether that's something that people use formally or informally, and how you use those kind of resources.
Yeah, so the time slips came from a lady that was kind of volunteering in aged care and just was struggling to find something that got people with dementia talking. And she had a theatre background. And it wasn't until she turned up one day and gave everybody an image, perhaps imagine sitting in a group and they all had a photo of, I don't know, I think one of the images is a polar bear, flat out on the ice with a newspaper in front of him. So they're not images of, I don't know, Marilyn Monroe or anything where there's a right or wrong answer. It's coming from that theatre idea, theatre sports sort of, yes, nothing's wrong. So just tell me, it's a storytelling intervention. What would you like to call him? What do you think's happening here? And people can give their snippets that get, much like the quilt, get written up and tied together into a story that's retold, so that the people in that group are taking on the role of a storyteller, because perhaps some of their roles have been, taken away. But to have the role of the storyteller is a familiar one. so they can become the author of a story that they collectively create. And I think that can be done formally in aged care. It's a lovely thing to do as an intergenerational activity. If you've got the primary school across the road, which is something that we've done in the past, and bring them in and run a storytelling group. It's beautiful to see the older adults looking after the kids, making sure they get a turn, sharing their stories, and that's a lovely, I guess, conversation tool, where there's a product at the end of a piece of art, I guess, that they have collaborated on. Yeah, but you can do it informally. You can go on the website and have a look at some photos if then you can have one of those more imaginative conversations.